All right, well, that was all very depressing. There must be some hope in all this. What can we do then? What are the treatment options? Well, the treatment options most of us we just do on our own. The first and foremost is really diet modification. I mean, we know what's going to set it off. This picture here on the screen of a hamburger, carbonated beverage, French fries, chocolate bar, that for sure is going to wreak havoc with my GI tract. So if we all do it, first thing we do is we start eliminating things that we know are going to cause reflux. First and foremost, that would be the spicy foods. Well, I can't eat those anymore. I'll be up all night long. Then soon after that, it's the caffeinated beverages. We got to get rid of those. Those worsen reflux. Fatty foods, pretty much all the fatty foods are going to make your reflux worse. So we stay away from that. As long as we stay away from that, we can sleep mostly through the night. Wife will be happy. Everybody will be happy. Won't get divorced. Then we realize it's the tomato-based things as well as the citrus things that worsen reflux, as well as chocolate, alcohol, God forbid, that's not going away, carbonated beverages, large meals, and even certain medications, specifically blood pressure and heart medications, can worsen reflux, and we can't eliminate those. Well, and we obviously can't give up medications. But now, however, the neighbor down the street, who's also got reflux, told me that there's these numerous websites I can go to find out how I can prop myself up at night. Apparently, gravity's your friend, so if you're propped up at night, things will slide down as opposed to coming up. So, lo and behold, he's right. I go to one of these websites and I get myself a nice little pill that props me up. Times are tough, however. I realize that financially not everybody can afford one of these fancy pillows, but he says there's also a website that'll show you how to put a block under your bed to prop yourself up in that way. Well, I do that, and that works for a while. Life is good. But then he also tells me that, well, you should try some of these medications. They're all basically over the counter, and so lo and behold, I do, and they work. That's Tums and Rolaids. We all start with that, but we start popping them like they were candy. In fact, we're popping them so often we got to run down to Costco to buy the big bottle. Then over time he tells me, no, there's better medications. There's something called Pepcid or Zantac. These are the H2 blockers. So I try those, and those work great. Those are wonderful. Those phenomenal. I still buy the big bottle just in case, carry them around in a backpack. But he says, no, recently they've all gone over the counter, even the big guns, the proton pump inhibitors, and these are the Prevaceds and the Nexiums and the Prilosec. And I try those, and I'm like, wow, this really does work. It cures my reflux. I'm all better. Well, the problem is the medications actually work by reducing the amount of acid in your stomach. All right, it's acid that produces the symptom of heartburn, okay, or that burning sensation. The problem with the medications is the relief is temporary. And usually requires either escalating the dose of the medication or changing the medication to a new medication. And that's okay, we'll do that. And we've got tons of medications that we can switch to. If you're not happy on your Pepto-Bismol or your Rolaids or your Maalox, we'll add Zantac or Pepcid or Acifex or maybe a combination of Prilosec and Tagamet because we want you to be happy. We want you to be really happy. There's a lot of reasons we want you to be happy. There's $10 billion worth of reasons we want you to be happy. This is a big industry here in the United States. $10 billion is spent per year on acid medications here in the United States. Well, I think that would be okay if medications actually stopped reflux. And that's, I think, what a lot of people believe. They come into me in the office and they go, well, I used to have reflux, but then I went on this purple pill and now I don't have reflux. My reflux is gone. It's been cured. Well, your reflux really isn't gone. Your heartburn is gone, but reflux continues really at the same rate. And this study has been done over and over and over again with the same results. This is just one example of one of those studies where they took patients and they took them off their medications and measured with that pH testing how many episodes of reflux they were having. And in this group, they were having 70 episodes per day. The whiter color represents more acidic reflux. The darker color is more alkaline. And then they measured the same thing when they were on their medications. And lo and behold, they still had 70 episodes of reflux. The only difference now was that majority of it was a little bit more alkaline or weakly acidic as opposed to acidic. So they had the same amount of reflux on or off the medications. All the medications were doing is masking the symptom of reflux, meaning the heartburn. So the medications do not stop reflux. Well, the other problem here is that the patients aren't exceptionally happy on their medications either. I think for some reason we think that everybody is happier than anything on the medications. Well, it turns out that couldn't be further from the truth. In fact, this is just a recent AGA survey which polled about 1,000 some odd patients and asked them just simply, on your medications, are you having any symptoms of reflux? Well, it turns out almost 40% of them were still having breakthrough symptoms despite medical therapy. That's a pretty substantial group. Now, the other factor in this was whether or not the long-term use of the medications was actually safe. In fact, a lot of patients are coming in now questioning that because they read this on the internet. What they see is FDA warnings about osteoporosis and possible bone fractures, to dependency issues on these medications, to magnesium deficiency, to focal arrhythmias, to increased risk of C. diff colitis. This recent publication in July of 2013, an unexpected effect of proton pump inhibitors, elevation of the cardiovascular risk. So what they found in this study was an increased risk of heart attack and stroke associated with long-term use of these medications. This was then followed in December of 2013 by this article on vitamin B12 deficiency. It only took about 2 years before patients were at about 1.65 times the risk of developing symptomatic vitamin B12 deficiency. These are serious consequences of these medications, and patients are concerned. Well, I think all that would be okay if the medications actually protected you against more worrisome complications. Specifically, really, esophageal cancer. I mean, I guess I could live with, the scar tissue issue or breakthrough symptoms, but, even if it's a 5% chance or a 14% chance of having esophageal cancer at the end of 10 years, that's something I don't want, obviously. And so this study actually was done a while ago, about 1999. It was published in the New England Journal of Medicine by a guy named Langerhans. And it was a fairly simple study. What he looked at was really just two groups of patients. Both groups had really bad reflux. One group took the purple pill. They took medications for relief of their symptoms. The other group chose to just grin and bear it. Didn't want to take medications, would just sort of live with the symptoms of reflux. And what he wanted to do is just look at the incidence of cancer in these two groups. The patients that took meds and the patients that didn't take meds. So here this bar graph represents what he found. The first group, represented in yellow here, didn't take any medications for their reflux. Again, they just sort of grin and bear it. They had bad reflux, but they didn't want to take anything for it. Now, for mass simplicity, we've sort of simplified the table here, but their risk, let's say, was 1. Now, what he suspected was that the medications would probably decrease that risk to somewhere around half of that risk, so somewhere around 0.5. But what he found, surprisingly, in the patients that took medications for their reflux was that their risk of esophageal cancer was actually almost 3 times that of those patients that didn't take medication. So not only weren't the medications protecting us, they seemingly were even increasing our risk of the development of esophageal cancer. And again, this is just a progression of reflux. Again, it's reflux that leads to the Barrett's, it's reflux that leads to the dysplasia, and reflux that leads to cancer. There's good evidence to suggest that this is being driven by the bile in the fluid of our stomach, not the acid, which may explain why the medications aren't protecting us against the cancer. The medications aren't going to do anything to suppress the bile. And if it's the bile that's driving this pathway, it's not surprising that they're not protecting us against the formation of esophageal cancer. All right, well, again, that really wasn't any more happy or anything than anything else. Still pretty depressing. There must be some hope in this. And I guess the hope in this, to me, would be something that actually restored the barrier to reflux. So what stops reflux? Well, we do have a couple of different options. There's minimally invasive surgery, or what we call laparoscopic surgery. The traditional treatment has been that of the Nissen fundoplication, or Nissen wrap. Over the years, we've tried numerous different endoscopic treatments, from Stretta to Endocinch to Enterex to Sofix to Metagoose. We're not going to go over them in great detail. Bottom line is most of them really don't work well, if at all, and so we're not going to spend any time on those. But one of the more recent developments has been a new procedure called the LINX Sphincter Augmentation Device, or LINX Reflux Management System. And we'll go into quite a bit of detail about both that and the Nissen fundoplication. So the first one, like I said, isn't a newer procedure. It's been around for 60, 65 years. We used to do it through a great big incision. With the advances in technology, we've been able to now do it through little incisions, or what's called minimally invasive or laparoscopic surgery. What this surgery is we actually mobilize and we free up the stomach. The stomach's actually attached to the spleen and around the diaphragm, and so we have to kind of free up all that tissue. We cut that tissue, and then we then wrap the stomach around the end of the esophagus where that weak valve is. And we then sew it there. Almost looks like a hot dog in a bun when we're done. And that wrapping of that stomach around there recreates a new one-way valve. All right? It's done laparoscopically, like I said, through little incisions. It's usually 5 little incisions, each of which are an inch or so in length. It takes most surgeons about an hour to 2 to do one of these. It does require an overnight stay in the hospital. Most patients take 1 to 2 weeks off of work. It does work, though. It's 90% effective in restoring the barrier to reflux, meaning fixing the underlying problem, that weak valve. It will immediately stop acid, bile, pancreatic enzymes, all the fluid in the stomach from coming up. Patients are able to stop their heartburn medications immediately post-op. And many publications have shown that it has substantially decreased the chance of developing Barrett's or progression to esophageal cancer. Well, are there any downsides to the Nissen? Well, as a surgeon, I'd like to stand up here and I'd like to tell you, no, there's no downsides to any of the procedures I do. But that couldn't be further from the truth. The 90% success rate that I quoted to you earlier is really in very experienced centers, places that do a lot of this. There's many a publication out there which shows that the success rate of these procedures is really down around 50 to 60% when done in a community setting or by surgeons that don't do a lot of this. There are some side effects of the Nissen fundoplication, such as gas and bloating and the inability to belch and vomit, as well as some difficulty with swallowing associated with the Nissen. Now again, as a surgeon, I could stand up here and I could tell you that, well, my patients are 90% of them are cured long-term for life. They don't really have any gas, bloating, dysphagia. They're all happier than anything. But unfortunately, with the internet today, that's not what is out there on the internet. What's out there on the internet is the community experience with the Nissen fundoplication. And there's some publications that have really driven this. And this is just one of them from 2003 that looked at just a handful of patients, in my opinion, 80. Looked at 80 patients that had a Nissen in the community somewhere. They followed them for a little over a year and a half, and they just simply asked them, are you satisfied with your Nissen fundoplication? And what they found in this study, and what's now on the internet, and all the blogs and everything else, is that only 60% of them were actually truly satisfied with having a Nissen fundoplication. Now the other problem here in that same study was 67% of them, because of the Nissen, now had new symptoms that they didn't have before, such as gas and bloating and difficulty swallowing. And now to add insult to injury, in this study, over 30% of them were back on their medications. So why are you going to have a procedure where only 60% of the people are actually happy, 67% of them develop new symptoms that they didn't have before, and about a third of them are still going to be on their medications anyway? Doesn't sound too good to me either. But again, I'll stand up here as a surgeon and I'll tell you, that's not my experience, my results. And many other surgeons will tell you that that's not their experience or result, but that doesn't matter. Because perception is reality. And this is what's on the internet. This is what's on the blogs. And what's out there is that the surgery is going to have to be redone in 10 years. That's what's out there. They all come in and say, so I have to have this done again in 10 years? I'm like, no, I don't know. No, why would you want to have it done in 10 years? But that's what's out there. The other thing is you're not going to be able to vomit ever again. Give it up. You can't vomit after a Nissen. 40% of you are still going to be on PPIs. You're still going to be taking your medication. You're going to be bloated to beat the band. And you're going to fly yourself to the moon with the amount of flatulence you're going to have after that surgery if you do it. So because of that, our GERD therapy of 2014 kind of looks like this. You've got about 60 to 70% of the patients that are taking the medications and are happy. They're fairly well controlled. There's about 30 to 40% of them, though, that have breakthrough symptoms or are concerned about the long-term effects of the antacid medications. But despite that, only 1% of them are getting anti-reflux surgery. They're scared of the side effects of Nissen fundoplication. So we have a good therapy that's going to stop reflux, but nobody wants it. And they don't want it because of the side effects or the perceived side effects that are out there on the internet. So again, to me, I think in regards to reflux and the reflux complications and esophageal cancer, we're losing the battle here. I mean, the dissatisfaction with the medications is increasing. The long-term problems or side effects with the medications, the evidence is mounting. Despite that, we're not utilizing the Nissen, a treatment that actually works, because of our concerns about the side effects. And in the background, our GERD complications, specifically Barrett's and esophageal cancer, is increasing at epidemic proportions. We're failing at treating this disease.